And joining me now to speak more about this issue, a medical health expert, Doyin Adetoro, and a policy analyst, Gbenga Onifade. Good to have you both join us. Let's begin with you, Doyin Adetoro. We've been seeing places like the UK and places like Australia, New Zealand, even now Israel, come up with some sort of lockdown, and South Africa as well. Is this some sort of the second wave what we've been talking about, or is this just a poor way of handling the whole pandemic?
I want to say thank you first of all for having me on. Yeah, there's been a lot of speculation that there could be a second wave coming on this winter in the US and also in Europe. And it's been said that people have been sort of more lax in their self-isolation, in using masks. And so there's a very big chance that they're coming up. And the experts and the CDC, for example, are also very concerned that, yes, there could be a second wave in the US or in Europe.
Gbenga Onifade, when you look at a country like the US, a country like India, where we've seen rise in cases, and then you look at Nigeria, where there was projection of widespread of coronavirus in the country, and yet was seen just about little over 57,000. What would you attribute that to?
Well, one of the things they said is, I mean, if you're going to look at the statistics, in Nigeria, we've had about 1,102 deaths, which is number 5 in Africa. I'm not talking about medal ranking, and is number 54 in the world. And if you compare it to the UK, where I am right now, which, of course, is developing, we talk about the first world nation. UK is number 4 in Europe, and the US is... and it's number 14 in the world, which is, I think, has got a death to date of about 41,000 approximately. So some of the things we said, we noticed as well, because I actually came in contact with someone who had it right at the peak of January when this thing came out. We said it's more likened to the fact that it's more, it's more prevalent in cold climate countries. So you could actually think it's actually more glaring when you are in an environment where this COVID-19 could thrive. So it's got nothing to do with the economy or society, but it's got to do with the environment. So when you look at COVID, which, I mean, when I went to the hospital initially in January, I remember the nurse telling me, oh no, it's just common cold, don't worry about it. So yes, while the awareness is actually more over here, and of course they got the money to spend, but I think it could thrive in an environment like this. And speaking of second wave, there's actually been a prediction right before even anyone started mentioning it at all, because we are approaching winter right now, and if you think about it, winter is actually more where cold is more prevalent, so we will obviously have it, and there'll be a lot of misdiagnosis as well.
All right, so let me go to Dr. Adetoro, and I want to continue from where Onifade stopped. He talked about environment and temperature, but we know that earlier on, with the outbreak of this virus, that the WHO did debunk speculations that temperature and environment has something to do with how it spreads. So help us understand why we're seeing this disparity in cases in the UK, US, and in Africa.
Yeah, well, studies have shown that there are different factors that's affecting the spread of coronavirus, right? Obviously, close proximity or contact with someone who has been infected with the coronavirus is one of the proven ways that it can spread. As we've seen, the summer months, regardless of the change in weather, there was this myth that as it was going to get warmer in the summer months, the coronavirus was going to go down. But you've seen the data that just come out. There's been an increase in certain states in the US and in the UK because of the reduction of the lockdown. And people were essentially, especially younger people, were going to weddings. They were in close proximity. People were going to restaurants. Recently, they found out about 11,000 people were actually exposed to coronavirus through flying, through using the airplane, right? So essentially, the way the virus spreads, obviously through contact, and also there's also some data that also could be airborne. So obviously, close proximity is one of the ways that we can be sure that if people do not pay attention to close proximity, that the virus itself, we can definitely have a second wave.
All right, to Gbenga, we are seeing new measures, lockdown measures in places like Israel and South Africa. How effective is this in terms of curbing the spread, especially because even for some countries that instituted the lockdown earlier on, we didn't see much change?
Well, like Dr. Adedoyin said, and one of the things I've got to say, credit to the people. We've got to give people the credit, People, we're looking at freedom-loving people, Nigeria, regardless of where you are, Australia, Africa. These are freedom-loving people, and for them to be able to give up their livelihood for the sake of rescuing the nation. So, number one, you got to give them the credit. But number two, in terms of effectiveness, I think some countries, they tend to be very calm about the lockdown. For example, you could see memes going around when, talking about the second wave coming around again. And the UK said, oh, we want to limit people to 6, and we want all gyms and all, this public gathering places to close at 10 p.m. And people thought, oh, are you telling me COVID's going to have a day off then? Or it's going to close at 10, like any other job. So one of the things is, I think that people need to do better. They could credit to them first and foremost, but they need to do better. The government is trying, but like a Nigerian proverb, it says, person way sweep, way no pack him. Now the person go, now the wind go blow him again, and the person go come sweep him again. So the same thing that happens. So we have actually been trying to curb this thing, but the government actually has to do a little bit better. The people have to keep doing better. There's been awareness first and foremost. There's a PPE out there which people are being aware of, but you do not have to lose your guard. We do not have to lose our guard. Otherwise, we are playing with a dangerous recession that's going to be happening around us, and it's already happening.
All right, to Dr. Adetoro, what should we be focusing on now? For example, we're seeing in a place like the U.S., there is a rush to come up with a vaccine, and not just the U.S., just around the world. But what should be the major focus at the moment?
Yeah, so the experts and the CDC, they've said equivocally that the easiest and best way for the regular citizen to protect himself from the coronavirus is to use PPE, use face masks, and to wash hands frequently, and to keep the proverbial 6 feet distance, and to avoid large gatherings. In regards to the vaccine, as you know, there's been a lot of politics around the issue of the vaccine, and the U.S. being that we're in an election year. Seems like the vaccine is being expedited, and the public, there's some reasonable concern that the vaccine essentially might be released before they have enough data on the efficacy and potential side effects. So the best way to really prevent another wave from coming on at this point is, like James Onifade said, is people really have to make sure they don't let down their guard. They have to continue to use the face mask and continue to isolate as much as possible and prevent large gatherings.
All right, let me just come to Gbenga finally. When you also look at the battle between economy and the battle between saving lives and public health, and we know that this has put a lot of strain on the health sector in almost every country, how would you expect government to be handling a situation like this, especially in places where the lockdown measures are brought in all over again?
Oh, it's great you said that, actually. If you look at countries around the world, and this is where we need to do better, if you look at countries around the world, there's actually been support, there's been help by the US government, for example. You look at all these Western governments, even in the UK, as of this morning, the Vice Chancellor is still talking about having to help out businesses, and how businesses, how they tend to relate with each other. Businesses have to take down the more calm role in terms of getting rid of people. So if we're going to take this back home to Nigeria now, I think number one is we need to form deeper relationships with our businesses. Yeah, it's all well and good having the infrastructures there, but we need to maintain deeper relationships with the businesses. You need handouts, make it worthwhile for the people that are trying their best, people that are really stretched out of the patience. I think when it comes to parties and weddings, people are happy to give that up for the benefits for the humanity, but I think the government, they need to work more with the people, work more with the businesses, not just the large organizations. You cannot ignore the small businesses, because the small businesses are actually saving the economy. And if you're able to build a relationship with them in terms of, it could be different ways. Stringent tax laws, for example. You don't have to print money, otherwise you just create an excessive, unmanageable inflation. Just build a healthy, friendly relationship with them. Give them tax breaks, for example. That might just be something, that way they're not easy or quickly getting rid of people, because when there's strain on the businesses, and of course it gets passed down to the people, and eventually the government will feel it themselves. So it's all about us right now coming together. Let's put anything economics business aside, but we need to start looking at the human side and build our relationships.
All right. Medical health expert Doyin Adetoro and policy analyst Gbenga Onifade, thanks to both of you for talking to us.
Thanks for having me.
Pleasure.